So now Dr. Namita is with me. Others, please remain numb. Yeah, Dr. Namita, you are doing any basic ultrasound? Yes or no?
Yes, sir.
Yeah. Good. So till now we have discussed about the transverse longitudinal sections. We have discussed about the basic of the these pelvic spaces, these muscles. Now let us see what next is. Yeah, TVS, transvaginal probe. Dr. Namita,
Yes, sir.
are you doing TVS scans also?
Yes, sir.
Very good. Now, in transvaginal scan, this is the marker.
Yes, sir.
If this marker is towards the ceiling, are you taking the longitudinal or transverse section?
So longitudinal.
Very good. Because beam is hitting like this. So this way you are taking the longitudinal section. Now, what to do to take a transverse section of the uterus? Where to rotate this?
So anti-clockwise.
So that it will go towards the patient's right or not?
Yes,
so,
sir.
Now, when you are inserting the probe, keeping the marker towards the ceiling, you are hitting the uterus from top to bottom. It means that you are taking a longitudinal section, and this will be the picture on ultrasound. Now,
yes.
Now think how many years you are doing TVS scans?
Say 2 years.
2 years. Fair enough. Now you know what is this? This thing. What is this called as?
Probe.
Footprint. Right or wrong?
So pardon?
Is this footprint of the image?
Yes, sir.
This is called as a footprint. Now, question. This footprint is on the top of the monitor always. Yes or no? In
Not
all,
always, sir.
in your machine, is it on the top or is in the bottom or is it in the right or is it on the right side?
Sir,
Is this now see? Is this the TVS image? Yes or no? This is the TVS image.
Yes, sir.
Why do you see this footprint on the top? Yes or no? This is the footprint.
Yes,
this is on the top. By top, I mean over here.
Yes. Yes,
It is not over here.
Okay.
It is not in the bottom.
Yes,
it is
sir.
not on the sidewise.
Yes, sir.
Right or wrong? So this footprint is
Yes,
on the top of the image. Now,
yes, sir.
now listen to me. When you are doing an abdominal ultrasound, this footprint is also on the top. But the point here is, when you are doing an ultrasound,
Yes,
by this trans-abdominal probe, you are putting on the patient's abdomen. Then it is correlating with where you are putting and where the machine is reflecting this. But now listen carefully. Now, if the patient's position would have been like this, then if machine is reflecting me this footprint on the top, it is correlating, yes or no?
So please repeat your question.
If patient's position is with legs towards the ceiling, this footprint should have been on the top, because it will be reflecting me that I am inserting the probe from the top. Yes or no?
Yes, sir.
Now, you told me yes. Now, is your patient in this position or in this position? Is patient lying on the bed or
The voice is not clear. So your
voice is very much clear?
Hello.
Listen to me carefully. Now listen. Your patient is lying on the bed.
Yes, sir.
You are inserting from sidewise of the patient. You are not putting the probe onto the tummy of the patient. Got it? Now, question.
No, sir. Sir, there is some. So there is some lag. Your voice is not clear, sir.
Just hold on, I will switch the mic. Wait. Is it clear now?
Yes, sir.
Yeah. Now tell me, your machine, your monitor is reflecting as if you have put the probe onto the abdomen of the patient, but actually you have inserted the probe from the sidewise of the patient. Then
Yes.
Why this footprint on the top? Why it is not onto the side of the image?
Okay.
You got this question now?
Yes, sir. Yes, sir. Yes, sir.
Now, does it mean that the machine has rotated the image by 90 degrees for your comfort, for your convenience, because you are always and always used to see this footprint on the top?
Yes, sir.
Now, another question from this question only. Does it mean that your screen orientation should get rotated by 90 degrees, then only it will correlate? Because machine has rotated the image for your comfort, for your convenience, because you are used to see this footprint on the top.
Yes.
Whereas this footprint should have been here.
Yes, sir.
Now, does it mean that your screen orientation has to be also reversed, not reversed, changed by 90 degree? Yes,
Yes,
then only it will correlate. Otherwise, it will not. This is the point why the screen orientation in TVS probes is not very good with all whosoever is doing.
Yes.
So you have to rotate your imagination, not imagination, the screen orientation by 90 degree when you are doing these TVS probe. Now, where is the anterior of patient? What is the name? Why is the anterior? What is the anterior? Anterior of patient. What is your name?
Sir, Namita.
Namita. Dr. Namita. You know where is anterior, where is posterior, where is right, where is left, where is superior, where is inferior on the image? Yes or no?
Yes, sir.
Yes. Is this side anterior of image? Yes or no?
Yes, sir.
Now, where is the anterior of patient? By anterior, I mean the front of patient. Here, yes or no?
Yes, sir.
No. Here is the anterior of patient. Anterior tummy, where is the tummy of patient? This side. So this is the anterior. And what is this? What is this side? Where is the head of patient? Where is the head of patient? This side, yes or no?
Yes, sir.
So this is the superior. This side is the head of the superior of patient. I am not talking about the image. So the point here is that when you are inserting, you should know that. Now see, this all the screen orientation will take me about 2 hours. And in our server-based class, it is taking more than 2 hours. Now the point here is that, sorry. Now the point here is that whenever you are inserting, you have to keep in mind that your probe is getting inserted from the side. And it is not that you have put it the probe onto the abdomen. Thereby, your screen orientation has to get shifted by or rotated by 90 degrees, then only it will work. Now, that is point number one. Point number second is that Dr. Namita, you have inserted the probe. Now you want to take the multiple scan planes of this longitudinal uterus where you will rotate the probe from right to left or from top to bottom, being in longitudinal section.
Sir, please repeat. So please repeat.
How the probe positioning, how the probe will be moved this way or this way. I mean, see to my hand, this way, right to left, or from top to bottom, being in longitudinal section.
In longitudinal from up to downwards.
No.
From anterior of the post.
No. No. Think. Let me repeat the question. You have inserted the probe, okay?
Yes, sir.
The image is coming up. Now you want to rotate, not rotate, you want to take the multiple scan planes of the uterus. Will you rotate this probe this way or up down or this way? Wait, let me, is my image coming? My image.
Yes, sir.
Imagine this is the TVS probe. I have inserted the TVS probe this way, right? Now, I am seeing on ultrasound monitor, I am seeing the uterus in length.
Yes, sir.
Should I rotate it? Not rotate. Should I tilt it this way to take the multiple sections or this way?
Sir, right to left, this side.
Very good. Right to left. This is the point. Now, when you are in longitudinal section, you have to rotate your hand, not rotate, you have to tilt your hand from right to left, then on the whole of the uterus will get scanned. See to my hand, right? Now,
yes, sir.
Now how to take a transverse section? You will rotate this probe by 90 degrees so that the marker will go towards the patient's right. Yes or no?
Yes, sir.
Then how to take the sections, multiple sections of transverse section? Again, doing this way, scanning. Yes or no? Right to left. Yes or no?
Yes, sir.
No. Here you have to move up and down, this way.
Yes, sir.
Got it?
To see. Yes, sir.
Yes. Now I will show you on the this image. Now see. Coming. Now, whenever the uterus is in longitudinal section this way, you have to rotate your probe, not rotate, you have to slide your probe from sidewise of the patient. But when you are in transverse section, now see, the probe is in transverse section because the marker is towards the patient's right. Then you have to make movements up, down, so that this beam, this scan plane will now move up and down. Clear?
Yes.
So this way, the probe movement should be in a transverse section. Now see again the transverse section demonstrating, because this part only you will see on ultrasound if you are taking the short section I mean the transverse section. Now you want to see this part. For that you have to bring this handle down, and if you want to move on to this part, I mean the cervix part, you have to make the movements up. And so here you have to move your hand up and down, not the side of the patient now. Side of the patient was for the longitudinal section. So for longitudinal, it is from the right to left of the patient, and for the transverse, it is up and down. So this is regarding the TVS schedule.